Dear students, so today we are going to deal with the fifth PSC mock test, okay, for the Kerala PSC Assistant Dental Surgeon 2025. So let's go on to the first question. Bone better described as bat with extended wings. Okay, so the bone which is better described as bat with extended wings is options ethmoid bone, sphenoid bone, nasal or mandible. So the one which is described like bat with extended wings is a sphenoid bone. Okay, option B. Question number 2. The preganglionic parasympathetic fibers for otic ganglion commencing at which region? Okay, superior salivatory nucleus or inferior salivatory nucleus or nucleus of tractus solitarius or lacrimatory nucleus. So, the preganglionic parasympathetic fibers are originating in the inferior salivatory nucleus. Okay, so inferior salivatory nucleus, option B. Question number 3. Which of the following muscle is attached to posterior part of pterygomandibular raphe? Lateral pterygoid or buccinator or superior constrictor or medial pterygoid? Okay, so which muscle is attached to the posterior part of the pterygomandibular raphe is a superior constrictor. Okay, option C. Question number 4. Main arterial supply to tongue. Ascending palatine artery or ascending pharyngeal artery or lingual artery or facial artery. The main arterial supply to tongue is option C. Okay, lingual artery. Question number 5. Lingual artery is a branch of which of these arteries? Okay, internal carotid or external carotid? Okay, so it's very clear. It's a branch of external carotid artery. Question number 6. Which of the following is not true about dystrophic calcification? So question is not true statement. Dystrophic calcification occurs in damaged tissue? Yes. Dystrophic calcification occurs in tuberculous lesion? Yes. Dystrophic calcification seen in atherosclerotic lesion? Yes. In dystrophic calcification, serum calcium levels are high? No. Serum calcium levels are low in dystrophic calcification. Okay, the blood calcium level will be low. So option D. Question number 7. Prostaglandins are synthesized from RNA template, rough endoplasmic reticulum, polyunsaturated fatty acids or none of the above. Prostaglandins are a product of which one? Product of polyunsaturated fatty acids. Okay, option C. Question number 8. Important components of collagen synthesis, wound strength and contraction include all of the following except. Okay, so question is except. So in case of collagen synthesis, you require fibroblast. In wound healing also you require fibroblast and myofibroblast. And very important for wound healing is vitamin C. What about vitamin D? Vitamin D is not much required. So option D is the answer. Question number 9. The necrotic tissue and deposits of immune complexes, complement and plasma protein produce a smudgy eosinophilic deposit which is termed as what? Coagulative necrosis or fibrinoid necrosis, caseous necrosis or fatty necrosis. A necrotic tissue will be there. Along with that, immune deposits will be there. Complements will be there. Plasma protein will be there. All of this together make a eosinophilic deposit which is known as a fibrinoid necrosis. Option B. Question number 10. Philadelphia chromosome is consistently found in acute myeloid leukemia, CLL, chronic myeloid leukemia or all of the above. Philadelphia chromosome is seen in chronic myeloid leukemia, option C. Question number 11. Schilling test is performed to find out folic acid level or vitamin B12 malformation or pancreatic enzyme deficiency or coronary artery disease. Schilling test is done for vitamin B12. Okay, malabsorption. To check whether there is any malabsorption of vitamin B12, we do Schilling test. Question number 12. Ventricular muscle receives impulses directly from the Purkinje system, bundle of His, AV node, left and right bundle branches. Okay, ventricular muscles receiving impulses from mainly from which area? Okay, Purkinje system or bundle of His, AV node or left and right bundle of His. Okay. Question number 13. Unmyelinated nerve fibers differ from myelinated nerve fibers in that they have increased excitability, they have no nodes of Ranvier, have no power of regeneration, have no association of Schwann cells. Unmyelinated nerve fibers will not have nodes of Ranvier. Okay, option B. Okay. Question number 14. Projections from substantia nigra pars compacta to striatum releases GABA or dopamine or glutamate or aspartate. projections from substantia nigra pars compacta to stratum will release mainly dopamine. Okay, dopamine. Option B. Question number 15. Lysis of RBCs are seen in which of the conditions? Except is asked. Okay, except. Lysis of RBC is present in thalassemia? Yes. It is lysis of RBC is present in methotrexate therapy? Yes. Lysis of RBC is seen in sickle cell anemia? Yes. Lysis of RBC is not present in obstructive jaundice. So option C will be the answer. Question number 16. Premaxilla is derived from maxillary protuberance or palatine bones or frontonasal process or median process. Premaxilla area is derived from option C, frontonasal process. Question number 17. Growth of condyle is by which growth? Membranous growth or interstitial growth or cartilaginous proliferation or bony apposition? Growth of condyle is by cartilaginous proliferation. Question number 18. Ugly duckling coincides with which phase? First transitional phase or intertransitional phase or second transitional phase? Or all of the above? Definitely only in one case, not all of the above. Ugly duckling will coincide with second transitional phase. Okay. Question number 18, option C. Question number 19. Which of the following has maximum familial tendency? The one which was hereditarily transmitted from father to their sons or daughters. Protruded maxillary incisor or open bite or deep bite or upper and lower cross bite. According to studies, deep bite has got more familial tendency. Okay, so option C. Question number 20. Which of the cephalometric parameter is used to diagnose a long face syndrome? Okay, whether the patient is having a long face or not is checked by which method? ANB angle method or SNA angle method or Jarabak ratio method or saddle angle? Option C, Jarabak ratio method. 21. Mainly elevators in exodontia work on liver 1 or liver 1 and 2 or liver 3 principle or wedge principle. Mainly elevators work on liver 1 principle. Okay, liver 1. Question number 22. In dentistry, which sedatives are generally used? Benzodiazepines or morphines or NSAIDs or petative? In dentistry, the sedative most commonly used is benzodiazepines. Okay. Question number 23. Which of the following local anesthetic is active topically? Lidocaine and benzocaine, lidocaine and mepivacaine, mepivacaine and benzocaine, prilocaine and mepivacaine. So the one local anesthetic which is active topically also you can use is lidocaine as well as benzocaine. Option A, benzocaine. Okay. Question number 24. Lower lip paresthesia occurs in which fracture? Body fracture or symphysis fracture, coronoid fracture, condyle fracture? Lower lip paresthesia occurs in body fracture. Okay, option A. Question number 25. In blowout fractures, which of the following is seen? In ophthalmos, exophthalmos, bulbar hemorrhage or none of the above? In blowout fractures, what happens? The eyes will go inside. Okay, so in ophthalmos. Okay, option A. Question number 26. Source of nitrogen in urea cycle. What is the source of nitrogen in urea cycle? Arginine and ammonia, aspartate and ammonia, uric acid and ammonia, glutamate and ammonia. Source of nitrogen in urea cycle is mainly that of arginine and ammonia. Okay. Option A. Question number 27. Prolonged carbohydrate deficiency leads to metabolic alkalosis, ketoacidosis, vitamin C deficiency, respiratory acidosis. Okay, prolonged carbohydrate deficiency leads to, if you have prolonged carbohydrate deficiency, it will result in ketoacidosis. Okay. Okay. Question number 28. Insulin causes lipogenesis by all except. So, insulin will cause lipogenesis by increasing acetyl coenzymic carboxylase activity? Yes. By increasing the transport of glucose into the cells? Yes. By inhibiting pyruvate dehydrogenase or by decreasing intracellular CAMP level? Definitely insulin will cause lipogenesis if it inhibits pyruvate dehydrogenase, but not in by decreasing intracellular CAMP level, I think. So option D is the answer. Okay. Question number 29. Scurvy is the result of deficiency of vitamin C. Very easy question and answer. Question number 30. Serum alkaline phosphate level increases in cases of which condition? Hypothyroidism or hyperparathyroidism? Option C, hyperparathyroidism. Question number 31. Characters of exotoxin include all of them except, okay, the exotoxins are protein polysaccharide complexes. Yes, they are heat labile or highly potent, has specific tissue affinity. They are definitely highly potent. They are having high specific tissue affinity. They are not heat labile. Okay, option B. Question number 32. Type 1 hypersensitivity is mediated by which of the following immunoglobulin? Type 1 is mediated by IgE. Okay, option D. Question number 33. Secondary response is mediated by IgG. Okay, option A. The special stain used for treponema pallidum, Giemsa staining or Gram staining of Masson Fontana Silva method or Zeal Nielsen method. Okay, special stain for treponema pallidum is option C, Masson Fontana Silva method. Question number 35. Which of the following is a RNA virus? Herpes is a DNA virus, Papaver is a DNA virus, Adeno is a DNA virus, Measles is a RNA virus. Option A. Question number 36. A black line on the gingiva which follows the contour of the margin. Okay, so just check out the sentence. They are telling it is following the contouring of the margin is due to lead, argyria or iron or mercury. Mercury toxicity. Mercury. Okay, black line on the margin. 37. Plaque differs from materia alba in which case? Whether plaque contains presence of bacteria, presence of glycoprotein, or presence of saliva, or absence of glycoprotein. Plaque does not have glycoprotein, so that is the difference between a plaque and a materia alba. So absence of glycoprotein. Question number 38. The most potent bone resorbing interleukin. Interleukin 8 or 1b or 5 or 3. So the most potent is interleukin 3. Okay. Question number 39. Which of the following soft tissue responses may occur as a reaction to orthodontic band? Okay. Marginal gingivitis, gingival fibrosis or ulcerative gingivitis or fulminating periodontitis. So, if you have orthodontic band, what will be the soft tissue response? In case of particularly mainly you will get marginal gingivitis. Okay, option A. Question number 40. Localized diffuse gingivitis extends from which area? From the interdental papillae to attached gingiva, from the margin to the attached gingiva, from the interdental papillae to the mucobuccal fold area, from the margin to the mucobuccal fold in a limited area. So localized diffuse gingivitis occurs mainly from the interdental papillae to the mucobuccal fold. Okay, not to the attached gingiva, to the mucobuccal fold. That too in a limited area. So that is why it is localized. So option C. Question number 41. Sensory motor stage is characterized by what? You have the child will have egocentrism or symbolic play, animism or conservation. The child will always have a symbolic play in sensory motor stage. Okay, option B. Question number 42. The primary reason for replacing the teeth destroyed due to nursing bottle syndrome is to recover speech and aesthetics, or whether for form and function of the child, or for incising and mastication purposes, or arch perimeter requirement in the transitional dentition. Okay, it's a very confusing question, but the most primary reason is always a speech and aesthetics. Okay, for a nursing bottle syndrome patient. Question number 43. After trauma of permanent maxillary central incisor, metallic sound is heard on percussion. This is due to what? This is due to whether the tooth has gone subluxation or lateral subluxation or extrusive luxation or concussion. Okay, it is mainly the tooth has gone lateral luxation. Because of that, there will be a metallic sound. Question number 44. The Buckley solution is composed of what all? The composition. Buckley solution. Cresol, formaldehyde, water, glycerin. Yes, the first option is correct. Okay. Cresol, formaldehyde, water and glycerin is the main content of Buckley solution. Okay. Question number 45. In a type of cerebral palsy characterized by sudden violent involuntary contraction of a muscle or a group of muscle, there is spasticity, ataxia, athetosis or rigidity. Okay, there is a sudden violent involuntary action. So it is spasticity. Okay. Next is 46. The two major fossa of permanent maxillary first molar are very easy. Central fossa and distal fossa. Option B. Central fossa and distal fossa are the main fossas in permanent maxillary first molar. Question number 47. The number of line angles in permanent maxillary central incisor. How many line angles are there? Okay, there are almost 6 line angles. Okay, so 6 line angles are present in permanent maxillary central incisor. Question number 48. What is the amount of time required by erupting premolar to move to 1 mm of the bone as measured on a bite wing radiograph. How long does it take for a premolar, question is premolar, to move through the bone, that to 1 mm, okay? It takes around 4 to 5 months, okay? So option B. 49. In an ideal occlusion, buccal cusp of the maxillary teeth will occlude in the which area? Grooves and embrasures, okay? In class 1, occlusion, buccal cusp will come and occlude in grooves and embrasures. Coming on to 50, lateral movement of the condyle is caused by contralateral lateral pterygoid muscle movement, or whether you require both lateral and medial pterygoid muscle movement, or only ipsilateral lateral pterygoid muscle, or bilateral contraction of lateral pterygoid muscle. For you to move the condyle laterally, you require both the muscles, both lateral and medial pterygoid muscle. Question number 51. Following are true about thyroglossal cyst, except often occurs in children. They may also present in adults, rarely may contain only functioning thyroid tissue, treated surgically by cyst trunk operation, moves downward on tongue protrusion. No, thyroglossal cyst moves upward on tongue protrusion. Okay, so that is a wrong statement. Question number 52. Which of the following conditions is characterized by abnormally large pulp chambers? Amelogenesis imperfecta, regional odonodysplasia, denogenesis imperfecta, dentine dysplasia type 1. Okay, so the one with large pulp chambers is mainly regional odonodysplasia. Question number 53. A patient is diagnosed of oral cancer of stage T3N2M0. Treatment of choice is surgery or radiotherapy plus surgery, chemotherapy alone, or surgery plus chemotherapy. So check the stage of the cancer. The patient is having T3N2, but there is no metastasis. Okay, if there is no metastasis, chemotherapy is not required. So surgery and radiotherapy will be the option. Option B. Question number 54. Phlebolytics are seen in dental pulp or salivary duct or cavernous hemangiomas or subepithelial bullas. Phlebolytics are mainly seen in cavernous hemangiomas. Option C. Question number 55. Ghost cells or shadow cells are seen in ameroblastic fibroadenoma. Yes, they are present. Calcifying odontogenic cyst. Yes. Compound odontoma also. So all of the above is the answer. Okay. Ghost cells are seen in all these three conditions. Okay. Question number 56. Which tumor does not occur in minor salivary gland? The one which is exclusively present in parotid gland is Wharton's tumor. So it doesn't occur in minor salivary gland. So Wharton's tumor will be the answer. 57. Pioneer bacteria in dental caries enamel will be present in which area? Enamel, dentine, pulp or cementum. Easy question. Dentine. Okay. 58. Difference in nicotinic stomatitis from papillary hyperplasia. What is the difference between nicotinic stomatitis and papillary hyperplasia? You can see the minor salivary gland duct swelling, okay, which will be present as a small centrally placed dot in nicotinic stomatitis. So option C. Okay. Question number 59. In cleidocranial dysostosis, sometimes the roots of a permanent tooth will be in cleidocranial dysostosis. There is hardly development of the tooth. So the tooth will be very small. So the roots also will be small. So option B or option C? Option B. Thin and short. Okay. Question number 60. Eruption fails in this bone disease as there is no bone resorption. So there is continuous bone deposition but no resorption in which disease? Among the option in osteopetrosis, okay, marble bone disease, there is continuous deposition of the tooth. The bone becomes like a marble. So marble bone disease or osteopetrosis. Question number 61. Radiolucent periapical lesion have the following except. Question is except absence of lamina dura, hanging drop of oil effect, opaque diffuse appearance, no movement of cone shift. See, they have already given radiolucent periapical lesion. Whether the opaque diffuse appearance will be there? No, right. So except will be C. Question number 62. Intensifying screen utilizes which property of X-ray? Intensifying screen uses the physical property of X-ray. Okay. Question number 63. Sharpened pencil appearance of a mandibular condyle on a radiograph will indicate what condition? Osteoarthritis or rheumatoid arthritis, infectious arthritis or juvenile arthritis. Sharpened pencil appearance of mandibular condyle is mainly seen in rheumatoid arthritis. Okay. Question number 64. McGregor line and Trapnell lines are seen in which view? Okay, PNS view or PA view or SMV view or lateral view. McGregor lines and Trapnell lines are seen in PNS view. Question number 65. Which of the following is a device of radiation dose measurement? Storage, phosphor plate or ionizing chamber, college tube or charge couple device. Okay, for measuring radiation dose, you always use a ionization chamber. Question number 66. In facial porcelain margin, the risk of fracture can be reduced by doing which method? By increasing the axial depth up to 3 mm? No. By cavo surface margin of 90 degree? Yes, it's a possibility. Margins of the tooth reduction at incisal edge? No. Providing contact during centricalation? No. So best method to reduce fracture in case of a facial porcelain margin is to give a 90 degree angulation. Question number 67. Flux is used during casting to remove the oxides formed on the gold alloy or lower the melting point or replace the casting wax or speed the burn process. Flux is always used to remove the oxides formed on the gold alloy. Option A. Question number 68. Non-rigid connectors are indicated for an FPD when the condition is given. It is not possible to prepare two abutments with a common path of placement. The abutments are prepared with a common path of placement. Abutments have a poor crown to root ratio. Abutments have an ideal crown to root ratio. So the first option, it is not possible to prepare two abutments with a common path of placement. In such a condition, you can give a non-rigid connector in case of an FPD. Okay. No common path of placement. Question number 69. The first step in surveying the cast for RPD is establishment of guiding plane, establishment of undercuts for retention, establishment of tooth contour for aesthetics, establishment of interferences for major connector. First step in surveying the cast for RPD is you have to establish a guiding plane for RPD, isn't it? So establishment of guiding plane. Question number 70. Labally inclined anterior teeth preventing the conventional clasp design may be better implemented with the snowshoe effect, swing lock concept, Boucher's concept or Kennedy's concept. Okay. The labally inclined anterior teeth preventing conventional clasp design may be better implemented with the swing lock concept. Okay. Question number 71. Which one of the following provides most conservative approach while restoring the tooth? Cast gold or dental amalgam or GIC or composite resin? So less amount of tooth removal is required in composite resin. Okay, conservative approach. 72. Calcium hydroxide is used in deep cavities in order to form dentin bridge, to kill the microorganism, to cause necrosis as a base under restoration. It is always given to form dentin bridge in case of deep cavities. Okay. Question number 73. Setting time of amalgam is best controlled by, how can you control? By improving the trituration. Okay, so trituration time. Not by using spherical particle, not by lathe cut alloy, altering mercury alloy ratio. All this will not change the setting time. Only trituration time will, we can better control the setting time of amalgam. Question number 74. Discolored areas seen through the enamel in the teeth that have amalgam restoration are known as amalgam tattoo, amalgam overhangs, amalgam blue or amalgam ditching. So by read the question carefully, it is not amalgam tattoo. Amalgam tattoo is seen in the gingival area or in the buccal areas. See, they have clearly asked discolored area seen through the enamel. So through the enamel discolored area seen is called as amalgam blues. Okay. Question number 75. The term stepping is associated with what type of preparation? Root canal preparation or direct gold condensation, silver amalgam condensation or fracture mandible. So in case of direct gold condensation, we have learned stepping. Okay. Okay. 76. Shade selection is done in how much time to avoid fatigue of eyes? You have to do in a very less amount of time. So 5 seconds. Okay. 5 seconds. 77. While working with dental material, the factor C is associated with what? Condensation force or tensile strength or polymerization, shrinkage or carving of amalgam. C stands for condensation force. Okay. Question number 78. Pickling is done to remove the oxide film from the casting, polish the casting, improve the strength of the casting, avoid casting defect. Pickling is done to remove oxide from the casting. Okay. 79. Hand cutting instruments are composed of handle, shank, blade. Easy question. Option number 2. Okay. Now, question number 80. The disadvantage of winged rubber dam retainer is that it interferes with the placement of what? Okay. It will interfere with the placement of a matrix band. Okay. That is why winged rubber dam retainer. That is a disadvantage. Okay. It interferes with the matrix band. Question number 81. Apical construction is otherwise known as what? Minor diameter. Easy question. Apical construction is minor diameter. 82. Which of the following is the method of treating internal resorption? How will you treat? By extravasation of pulp and calcium hydroxide dressing? By extravasation of pulp and you give a formicrosol dressing? No. Option C, pulpotomy or pulp capping. So better you remove the pulp and you give a calcium hydroxide dressing, because to improve the tooth from inside, because it has undergone internal resorption, you have to go calcium hydroxide. 83. The last solution used in a root canal treatment to avoid painful surgical emphysema before dressing is, the last solution used is always a sodium hypochlorite. Okay. 84. File commonly used for flaring of the canal and retreatment. H file. Okay. For retreatment, to give more flaring of the canal, you always use a H file. Okay. Question number 85. Corrosion of silver cone is due to the presence of cobalt, tin, nickel or zinc. Nickel. Okay. Corrosion of silver cone is due to the presence of nickel. 86. Microabrasion is a procedure in clinical orthodontics performed to clean the bracket base or clean the arch wire or polishing the bracket or removal of other white spot lesion. Okay. So you need to remove white spot lesion in orthodontics. You have to do microabrasion. Okay. Option D. Tetracycline is more preferred in periodontics because, option, it is broad spectrum antibiotic. Yes, of course, tetracycline is a broad spectrum antibiotic. It has anticholinergic effect. Yes, it has got anticholinergic effect also. All of the above. Yes, then that is answer. Option C. 88. True about amoxicillin in comparison to ampicillin. Higher oral bioavailability. Yes, that is true. Amoxicillin has got higher oral bioavailability. Option B, lower bioavailability, is wrong. Equal, no. So option A, higher oral bioavailability for amoxicillin compared to ampicillin. 89. Which of the following is the drug of choice for antibiotic associated pseudomembranous enterocolitis? What do you give? If you have a drug of choice, if you have antibiotics, you have given antibiotics for a long period of time and you end up in pseudomembranous enterocolitis, you have to give the patient oral vancomycin. Okay. Only then you can remove this particular enterocolitis. Okay. Oral vancomycin is the drug of choice. Question number 90. All of the following glucocorticoids can be given by inhalation except, okay, glucocorticoid which can be given by inhalation, beclomethasone, yes, it is a safe drug. Budesonide is given inhalation method. Fluticasone is also given by inhalation method. Dexamethasone, option A, is not an option for inhalation. Okay, so option A. 91. Brinell hardness number of a dental gold alloy is directly proportional to its tensile strength or elongation, modulus of elasticity, modulus of resilience. To its tensile strength. Brinell hardness number of a dental alloy is directly proportional to its tensile strength. Okay. Question number 92. Impression compound is characterized by all the following except. Impression compound wraps at room temperature. That's true. Is a thermoset material? No. Shows increased flow when heated with water? Yes. Low coefficient of thermal conductivity? Yes. So impression compound is characterized by all of the three except thermoset material. Okay, so option B is the answer. Okay, 93. Which of the following impression material requires a hardener? Agar, arginate, elastomers or impression compounds? Impression material requiring hardener is agar material. Okay, agar. 94. The cross-linking agent of polysulfide rubber-based impression material is aromatic sulfonate esters, stannous octade, platinum salt catalyst or lead dioxide. The cross-linking agent of polysulfide rubber-based impression material is, which is the cross-linking agent? Aromatic sulfonate esters or stannous octade, platinum salt catalyst or lead dioxide. Cross-linking agent will be lead dioxide. Okay. 95. Condensation reaction occurs in agar, arginate, polysulfide or ZOE. Polysulfide. Okay. Condensation reaction occurs in polysulfide. The labiodental sounds are F, V and PH. Yes, correct. F, V and PH. The labiodental sounds are F, V and PH. Question number 97. The ideal bone for implant support. Spongy bone, cortical bone, lamellar bone, woven bone. Yes, lamellar bone. Okay, ideal bone for implant support is lamellar bone. Question number 98. Morphological stages of tooth development are explained based upon shape of the enamel organ, shape of the tooth germ, functions of enamel organ, either A or C. Option A is shape of the enamel organ, option C is functions of enamel organ. Morphological stages of tooth development are bud stage, cap stage, early bell stage, advanced bell stage. So they are based upon the shape of the enamel organ. Question number 99. A data collected for specific purpose and used for the same purpose is called a primary data. Okay, you're collecting the data and using for the same purpose only. Then it is called as a primary data. Last question. Xylitol is a low caloric sweetener, inhibits the growth of which organism? Streptococcus mutans, Streptococcus pyogenes, Lactobacillus or Actinomycosis. Xylitol will inhibit the growth of Streptococcus mutans. Okay, so that's it. So we have come to the end of model paper 5 for the PSC, Kerala PSC upcoming exam. So do revise these videos and it will be very easy to recollect the questions and answers. If there is any doubt regarding any of the question and answers being marked or any further explanation is required for a particular question, please comment down below the video so that we can give you the explanation. Okay, thank you. There are a few mistakes when we have marked the answers. Okay, so just note down before winding up the video. So question number 12, ventricular muscle receives impulses directly from I marked as bundle of hairs. The answer is Purkinje system. Okay, the ventricular muscle receives impulses directly from Purkinje system. Okay, not from bundle of hairs, it is Purkinje system. Okay, so the next question is the source of nitrogen urea cycle. Actual action option is answer is aspartate and ammonia. Okay, the answer is aspartate and ammonia. Just please note down. Sorry for the correction. Source of nitrogen in urea cycle is aspartate and ammonia. And question number 28, insulin causes lipogenesis by all of them except the answer is inhibiting pyruvate dehydrogenase. Okay, so inhibits pyruvate dehydrogenase. Insulin caused lipogenesis is by except. They have asked except, so you have to note down except. So inhibits pyruvate dehydrogenase method. Okay, then next one correction, characters of exotoxin include all of them except they are not protein polysaccharide complexes. Okay, so that is the answer. Okay, because so whenever you mark the answer, please note down whether they have asked except or not. Okay, so characters of exotoxin include all except when it is asked you have to mark protein polysaccharide complex. Now coming on to two more corrections. Plant differs from materia alba in the presence of glycoprotein. Okay, so by mistake I have marked as absence of glycoprotein. Plaque will have glycoprotein, so presence of glycoprotein. Okay, question number 38 also, the most potent bone resorbing interleukin is interleukin 1b, not 3. The most potent bone resorbing interleukin is interleukin 1b. Okay, so please note down. One more correction, last one. Localized diffuse gingivitis extends from the margin to mucobuccal fold. Okay, margin to attach gingiva in a limited area. Okay, it extends from margin to attach gingiva, not to mucobuccal fold. Okay, from the margin to the attach gingiva. Okay, so please note down these corrections. I hope it's very clear now. Thank you. Please do subscribe the channel. If there is any error being marked while solving the paper, it will be discussed at the end of the video. Okay, please watch the video full. So one more correction is there. While working with dental material, the factor C is associated with polymerization stringage, not condensation force. Okay, it is concerned with polymerization stringage. Okay. Okay, this comes the last. So this was not marked, that is why it is given as wrong. Okay, the labial and dental sounds are FBPH. That is correct answer. Okay, so with this we come to the end of the video. Thank you. Please do subscribe the channel and watch the videos. If there is any doubt, please comment down the below video. Okay, thank you.